Hello, you are welcome to today's class. My name is Dr. Isaboyin Henry, and we are continuing our class on demography in social statistics. And today we are taking lesson 6. And as you can see on the screen, our topic is sources and quality of demographic data. Sources and quality of demographic data. Remember, this lecture is a continuation of the lecture series on demography and social statistics in public health. So let's go straight into the introduction. Understanding the demographic data is crucial for effective public health management. And demographic data provides the backbone of decision-making in public health. And it allows practitioners to be able to assess the health status of various populations, to identify emerging public health problems, determine the appropriate allocation of resources, for example, healthcare workers, medical supplies. It will also help them to develop and implement effective preventive measures. And in the context of public health, good quality demographic data helps in designing the health policies that cater to the specific needs of a population and ensuring that interventions are relevant and are timely. So taking them one by one for better understanding, like I told you, it will help practitioners when you have a good data, demographic data of quality. It will help to assess the health status of that population. No matter how, heterogeneous they are, we will still get a very good representation and interpretation of those data. So we can assess their health status. We can identify the emerging public health problems. We can also determine the appropriate allocation of resources, so it is well managed, both for the healthcare workers, in case of healthcare workers distribution and medical supplies. It will also help us to develop and implement, like I said, effective preventive measures. So these are key. Now let's see data sources in demography. Data sources in demography. Remember, we talked about it earlier, but this time we are breaking it further. So the first part we'll be seeing is the census. We'll be seeing the census. Now, as a definition, a census involves the complete enumeration of a population, where every individual in the designated population is counted. It aims to gather comprehensive demographic information such as age, gender, occupation, ethnicity, and housing conditions. Now, what are the strengths? Accurate population count is one of the strengths. The second strength is that there will be comprehensive data. The third one is that you have governmental representation. So these three are very key. Let's see them one by one as part of the strengths of having a good census, which is a source of data for demography. Now, in terms of accurate population count, a full count of the population will ensure that no one is left out, and this is essential for assessing the size and distribution of population. Now, take note, when we say population, we are talking of both male, female, elderly, young, babies, and even the ones that are born and the ones that are dead. All those data will be put together. Very important. Now, for comprehensive data, which is number 2 strength or advantage of good census data, censuses collect rich data on several demographic factors that inform governmental planning, such as urbanization, housing, and economic development needs. The third one is the governmental representation. Now, it's simply telling us that a census without the presence of the government or political representation will undermine such a project. So census data is crucial because the politicians, or let's say political representations, will be needed to determine the constituency boundaries, election districts, and the equitable distribution of government funds. For example, when you want to do an census, the census is very important because it is coming from the government, number one. Number two, it is approved by the government. And number three, the government is putting the machinery in place. Now, one of the reasons why they do that is because it will help to have a proper allocation of government representation, such that the data, as crucial as it is, it will help to ensure that every area has proper political representation. And it will go further to determine the constituency boundaries. Okay, this is the boundary for this political, alignment. This is the boundary in terms of representation of those maybe local governments or councils and so on. And it will also help to determine the election districts, who is to man here and what to man and where is the boundary to which it can man. And also, it will give room for equitable distribution of government funds. For example, you have several programs coming up by the government, and there will be need to distribute adequately, proportionally, according to the needs. And so it will come definitely by basis of the census data received and also other data put together. Now, what are the challenges for census? Number one, we have underreporting. Underreporting, I believe you are writing and taking notes. Remote, rural, or marginalized areas might be undercounted due to access limitations, cultural differences, or non-cooperation from residents. And this is very, very important because some persons may not cooperate, and there are some persons by cultural differences give one excuse or the other to evade the census. And there's nothing you can do as a census attendant who is in charge of doing that. The people just run away. They don't want to open their door. You won't force them. You are not going to deal with them or beat them. It's their right, but it's important that you let them understand that there's a need to. So non-cooperating residents can also be a challenge. Let's see the limitation number two. It is costly and timely. It takes a lot of time and it costs a lot. So conducting a nationwide census is resource intensive and it requires significant time and a lot of fun because we have to pay a lot of workers indeed as they go around the entire nation. And this makes it difficult to conduct frequently. And the last one is there could be sampling errors. There could be sampling errors. We have seen underreporting, cost and time, and sampling errors. And in areas where census data is sampled, instead of a full enumeration, there can be errors or imprecision, especially in small rural communities, leading to inaccurate representation. Let's see the second part under data sources in demography. We have seen census. Let's say the second one, vital registration systems, where you have birth records, death records, marriage records. Now, if you look at it, by definition, vital registration systems track essential life events, including births, deaths, marriages, and divorces. Now, these systems provide the raw data necessary to compute key demographic indicators like birth rates, mortality rates, and life expectancy. Let's see the advantages in terms of strengths. Number one, it's reliable mortality and fatality data. It's a reliable mortality and fatality data. Number two, it helps in health outcomes monitoring. It gives a lot of advantage in health outcomes monitoring. If you look at it one by one, under the reliable mortality and fatality data, you find out that birth and death certificates provide high quality continuous data that are essential for calculating mortality rates and life expectancy. So in these offices, birth certificates are given, death certificates are issued, regrettably, to parents or people who have lost their loved ones. And when these certificates are given, they are recorded. and that numbers are taken, into consideration, and they are updated every time a certificate is issued. So this information is indispensable. It is easy and essential to calculate this mortality rate, and then you can also calculate the life expectancy. So it's very important. And remember that this record is dynamic and it shows the health trends. For the case of health outcomes monitoring, these registries enable the monitoring of public health interventions over the time, such that the effectiveness of vaccination programs or the impact of maternal health campaigns are easily portrayed. So you see that these registries, when they keep putting this data together as it's expected, they can monitor public health interventions over the time. What we've done in this community, how is it faring? Are we seeing the results? Are we seeing the impact as the people come for registration? Are we seeing the differences? What we envisaged, where we spent the money, where we did that campaign at that time, are we getting the results as expected? So that effectiveness is seen. For example, if it is a vaccination program that was done, they want to see the impact on maternal health and also the life of the children. At that category, they want to see that there is proper growth. They want to see that all those diseases that have been affecting them in the past has really, really come down. The incident rate is now very low. They want to also see that there's improvement. They want to see the health outcome, expecting it to be on the positive side. And so this data help us to be able to monitor health outcomes. However, there are challenges. So let's see the limitations. Number one, you have a case of underreporting. Number two, misclassification. And number three, you have cases of inconsistent coverage. Now, under limitations, in certain regions, especially in those low income or remote areas, the registration of vital events, may be incomplete, because you find that in those remote areas, the registration of those vital events probably are not followed up. Sometimes they go to work, sometimes they don't go to work. And again, you find out that apart from their presence or non-presence at their offices, most persons don't go to demand for birth certificate or death certificate, because at the rural area, perhaps they are not even aware of the importance of it. They give birth, they move on with their life. Then somebody dies, they just find a place and do the normal ceremony, and then they bury. They don't believe in getting the death certificate. Not everybody bothers about that. So you find underreporting taking place, and this could result from a lack of infrastructure, awareness, or reluctance to participate. You have misclassification also. There may be issues with misreporting, and that is very, very important that we take note. Apart from the misreporting, there could be problem of misclassification, especially concerning the cause of death, which can skew public health data and also can hinder the development of targeted interventions. And this is key. Why? Because sometimes when this data is being taken, if it's not taken by somebody who is very good, experienced, he misreports it. Where it's supposed to put age, is putting death. Where it's supposed to put death, you could have these mistakes takes place, and you could also have misclassification in the wrong place. Sometimes the age can be very wrong. Data's incomplete, data's not correct, and then data's in the wrong place where it shouldn't be concerning the cause of death. All these things will skew the data looking one-sided, and you are wondering, what happened throughout this week? Not knowing that it's a mistake in the numbering. Somebody, instead of 1, 2, 3, just jumped to 13. And then you are seeing 14, 15, 16, 17. So these mistakes could happen, whereas it's just only probably 10. And so those are the errors that could happen. And when they do, they hinder development of targeted interventions. The next one is inconsistent coverage. Yes, some events such as stillbirths or domestic partnership may not be fully registered. That's very, very important. It may not be fully registered, and we need to understand this because it will leave gaps in the demographic data. That's very, very important. Now let's see the third one, surveys. We are still dealing with data sources in demography, and now we are looking at surveys. I told you the last time that we have both the national and the health surveys. In terms of definition, surveys involve collecting data from a sample of the population rather than the entire population. Just a sample. You look at it and say, okay, let's go to the local government. Or you make up your mind and say, okay, instead of dealing, let's deal with this age category across social and social centers. But this time, you are not dealing with all of the population. You are taking a particular sect, and you must decide why you are taking that sect and why is that sect appropriate. Now, these surveys are designed to investigate specific health behaviors, health outcomes, or determinants of health, such as diet, exercise, or vaccination coverage. I repeat, such as diet, exercise, or vaccination coverage. Now, in terms of strength, what's the advantage of doing this survey? It's very important. It offers flexibility to address specific health questions. When people come around, they can ask questions, and these surveys can be tailored to address specific health issues and conduct in-depth investigations into those health-related topics because you are speaking to them one-on-one, such like smoking prevalence or maternal health. You can also see the issue of timeliness. Surveys can be conducted on a regular basis. Example, annually, biennially, which allows for the continuous monitoring of public health trends and the swift implementation of interventions in response to emerging health concerns. So this is key. We also have cost effectiveness. Cost effectiveness. Compared to a full census, surveys are generally less expensive. Like I already told you, you're just dealing with a sect of the population, not all the population. And it is quick, very quick to administer, making them useful for collecting up-to-date data on various health issues. But that does not mean it doesn't have its challenge. It has its own challenge as a matter of fact. Number one, you see the sampling bias. There's sampling bias. If the sample is not representative of the broader population, then the result can be skewed. That is, you get a result that is not actually representing the entire population. For instance, certain demographic groups, example in the rural populations of the elderly, might be underrepresented. So, for example, we want to deal with a challenge that has to do with everyone, and then you are dealing with a population that essentially has only youths. Now, of course, whatever you get out of that data, will not really be sufficient enough to represent the aged, the adults, the elderlies in that community. And so if you consider that report, you will see it to be skewed to one side. A lot of it will not be in favor or a good representative or representation of the elderly, and you'll find out that they will be underrepresented. Another disadvantage or challenge is the data accuracy. The accuracy of survey data can be compromised by non-response poor survey design. Or sometimes it could be error in how the respondents interpret or report their behavior. An example is that underreporting of risky behaviors like alcohol consumption. So now you are finding out an information, and then you are doing it in a community where a lot of them are Christians. And you find out that that community is such a community where majority have a very extreme, Christian belief. Let me use that word. They don't just do what others do. They don't drink. They don't take alcohol. And then you go to such a community and you are doing a research on alcohol, and you are taking that community to represent the entire population. So you find out that you almost have concluded that in that community, the intake or consumption of alcohol is very low. Whereas this will contradict the sales of alcohol, at wholesale being sent to that community. And you wonder, where are those alcohols going to? If this report is saying that we have done a survey, and in the survey that we have done, we have discovered that that community do not really consume alcohol. You see, to contradict, and many of them take this alcohol for pleasure. So imagine if based on this, you now have resultant policies coming out because that community is believed not to be at risk of certain diseases, because they do not take those vices, those drugs, those drinks that could cause health issues. And so the policy may not be in the favor, whereas the policy is supposed to show how they can carry out campaigns that will help that community, and to advise them, and to also see how they can improve on the low intake of alcohol and drugs, and also to put some bans for drugs and so on. So that won't take place because it's believed they don't. And this is as a result of the data accuracy issue. So when you have errors in the data, or you have done the survey design wrongly or poorly, or you have used the wrong selection of population, you will see that underreporting will take place. Now, the next one that we want to deal with under this data sources in demography is sample registration system. The sample registration system, that's another source of data for demography or in demography. Now, let's see the definition. The sample registration system is a continuous demographic monitoring system. Take note of that, a continuous demographic monitoring system that collects vital statistics. They collect vital statistics. And what vital statistics are these? Births, death rates, by using a sample of households. It is commonly used in countries that lack the resources for a full census. So this is sample registration system. And like I said, it's a continuous demographic monitoring system that collects vital statistics such as the birth and death rates. And it's essentially used by countries who do not have the resources for a full census. What are the strengths? Number one, the reliable estimates. Now, the SRS, known as the sample registration system, provides reliable estimates of fertility and mortality rates, which are crucial for monitoring public health and guiding policy decisions, even when full consensus data is not available. Number two, in terms of strength, under the SRS is continuous monitoring. You see, unlike the periodic surveys or census, the sample registration system, known as SRS, allows for ongoing data collection, thereby making it possible to track demographic changes in real time and adjust public health interventions promptly. Now, what are the limitations? Sample size and geographical coverage. That's one major limitation in terms of sample size and geographical coverage. The accuracy of the SRS is very limited by the size of the sample and the geographical coverage. Very important that you take note about this. A small sample might not reflect the diversity of true composition of that larger population, especially in highly rural or remote areas. And you also find cases of discrepancies. Yes, discrepancies. There can be discrepancies between the actual event and what is reported in the SROS. Yes, there can be discrepancies between the actual event, what happened at the event, and what is reported. And this is due to incomplete data collection, reporting errors, or misclassification of events. So take note about that. Like I said, under SRS, the strengths include reliable estimates, you get continuous monitoring, but the limitations include the problem of sample size and geographic coverage. And then you have discrepancies that could occur from differences, between the actual events and what is reported. So that is that. Now let's see number three. We have seen the data sources. Now let us see how to evaluate data quality. Evaluating data quality for public health decision making. Now, the quality of demographic data is a key determinant of the success of public health intervention. So inaccurate or incomplete data can actually lead to incorrect conclusions about the health problems. It can also lead to misallocation of resources, and this will result in ineffective interventions. It can also lead to delayed responses to health crises such as disease outbreaks or natural disasters. To ensure the reliability of demographic data, certain quality dimensions must be considered. If you want the demographic data to be reliable, if you want it to be useful, the quality dimensions must be considered. Number one, as part of the key quality dimensions, number one, completeness. Now, this refers to ensuring that all relevant data are captured and that no critical information is omitted. For example, all births, deaths, and marriages in a region should be recorded without gaps or exclusions. This is important. Number two, as part of the quality dimensions that must be ensured so that you can have quality data, number two is accuracy. Number three is timeliness, and number four is relevance. Let's go back to accuracy. Now, data must accurately represent the real-world phenomenon, not something else. The real-world phenomenon. That's why you are interviewing the people and you are talking to the population one-on-one. They are, that data that you will derive. Because if it fails to accurately represent the real-world phenomena, the real-world case, as it were, it will mislead decisions that will be taken. And they will not be able to get the accuracy in what they are measuring. For instance, death certificates should correctly indicate the cause of death, and surveys should accurately record respondents' health behaviors. So it's very, very important. If you say this is the death certificate, you should be able to state the cause of death, and then the survey should be able to accurately record the respondent health behaviors. Now let's see number three, timeliness. Data should be collected and made available promptly without delay so that public health actions can be based on the most current information, not using the old information. For example, if a survey shows rising rates of a disease, intervention must be implemented immediately to control the spread. The last one under the key quality dimensions that are needed in order to have good quality data is relevance. You see, data must be relevant to the issues being studied or the problems being addressed. Irrelevant or outdated data, it can lead, it can mislead decision makers. And this will result in inefficient public health policies. It can result in inefficient public health policies. So this is very important as much as possible. And that if you don't get these qualities intact, completeness, accuracy, timeliness, relevance, the data will not make lots of sense. It may not achieve its purpose. So it's very important. Now let's see the second aspect. Now we want to evaluate the data quality. Let's evaluate the data quality. In doing that, we check for three things. Number one, validity, bias, and statistical significance. Validity, bias, and statistical significance. Now, in terms of validity, now this ensures that the data actually measure what they are intended to. For example, health surveys must be accurately assessing the health behaviors like physical activity levels or smoking status. It must be seen to accurately be assessing that specific behavior for which it is developed. Now, if the survey questions are poorly designed, the data will not reflect the actual situation. It will be talking about the other issues. Now, in terms of bias, this involves recognizing and addressing many bias in the data. So, in terms of bias, like I said, it involves you recognizing that this is a bias and addressing any bias in the data. Otherwise, if left, those data will cause issues and thus undermine the quality of your data. So, selection bias can occur if certain populations are underrepresented or overrepresented in surveys, while classification bias can result from errors in categorizing data, such as misclassifying the cause of death in a vital registration system. In terms of statistical significance, which is the third evaluating data quality, when analyzing data, it's crucial to determine if observed differences or trends are statistically significant. Now, this means the observed patterns are likely not due to chance. Yes, if you do it properly, you will find out that based on the statistical significance, like you do when you learn statistics or biostatistics, it will mean, following the result of the significance, that it was not due to chance. It's not happening because, well, that's what's supposed to be. No, it's not supposed to be so. That's what it's telling you, that this is not based on chance. This is not based on because it was meant to be. No. This means the observed patterns, like you have seen, it's not due to chance. For instance, if a health survey, shows that a new intervention reduces disease prevalence, it should be statistically tested to confirm that the results are reliable. So you find out a trend, then you carry out a research to statistically prove it, so that it will not be based on mercy or what we think. Let's see this table so that we can compare the difference. Let's see. Now we have on this table data source. We're looking at the strength and limitation of different data sources now. You have data source. Under it, you have the census, you have the vital registration, you have the surveys, and the sample registration. Now, let's look at the strength together. Now, for the census, you will see that one of the strengths is accurate population count, detailed demography data. But what is the limitation? It's expensive, time-consuming, and possibly underreporting. In terms of vital registration, it is reliable for monitoring mortality and fertility rates. However, the challenge is that underreporting, especially for stillbirths, may take place. Now, in terms of survey, under its strength, you can see that flexibility can address specific health questions. Sorry, please. Under the survey, as part of the strength, we see that it is flexible. That's what I mean. Sorry. It is flexible. Not just that it is flexible, it can address a lot of specific health questions because you are interviewing them one-on-one. You are dealing with the people, a small population, to represent the entire. So you have time to deal with that amount of population. However, the limitation is that there could be sampling bias. Oh, I know this person is my friend. I know this person. Oh, he wants to speak to your favor, and so on. So there could be sampling bias and variable data quality. And this comes with interest. So this bias comes up, but you have to, as much as possible, select your population scientifically using the best methodology technique, and then you can proceed to avoid bias. Now, for sample registration, the strength is that there's a continuous monitoring between censuses. Very important. And you also have the limitation where you have limited sample size, and possible discrepancies can take place. So let's see, in conclusion, the data from censuses, vital registration systems, and surveys play a vital role in informing public health policies and programs. It is essential for public health practitioners to critically evaluate the quality of these data sources before using them for decision making. Now, acknowledging and addressing the limitations of each data source will ensure better informed interventions, and this will lead to more effective public health outcomes. Understanding the strengths, weaknesses, and quality of data is critical for designing and implementing interventions that are both timely and relevant. Take note, that are both timely and relevant. So if you have good quality data brought on time, designed properly, shown to implement and shown to reveal a particular trend or challenge that require intervention, then you will see that interventions will be taken based on the decision reached using that quality data in both timely manner and a relevant manner. I want to thank you for listening carefully. Remember that I've said a lot of things you probably didn't find on this material, and I've been doing that from lesson 1. So it's expected of you to ensure that you take notes. It's expected of you that you ensure that you read and then take notes. And if you have questions, you move to the Telegram there and put in the Google Classroom to put in your questions, and I will take them when I come to the class, so that we'll have a robust discussion, solving the problems or the challenges or doubts, and then at the same time learning the more. So take your notes, pause when you need to pause, listen, and then make sure you understand. Read to read, to learn, to know, and not just to pass. I'll see you in the next class. Thank you, and have a wonderful time studying.